Welcome, doctors. Today, we are diving into a topic that every outpatient clinic faces in one way or another, the ongoing struggle with online scheduling and EMR integration. Let's start with a story that might sound all too familiar. A patient recently shared their experience trying to book a physical therapy appointment. They said, "I had to call the clinic, sit on hold, give my insurance info verbally, and still had no idea what I was going to owe until I checked in." That single experience highlights what many clinics still deal with every day: manual scheduling, clunky EMR workflows, and no upfront insurance eligibility checks. When we talk about scheduling and EMR integration, many professionals mention Epic's MyChart. MyChart does make life easier once patients are in your system. One healthcare IT professional even said, "Just use MyChart." But here is the problem. MyChart is not available to everyone. Patients only get access after their first appointment once they have been added into the system. And because MyChart is bundled with Epic, smaller PT, OT, or behavioral health clinics often cannot use it as for many independent practices, that level of convenience is still out of reach. This is where third-party scheduling tools come in. Platforms like ZocDoc or Visita have become popular among outpatient practices because they make online, but as many healthcare IT specialists have pointed out, the real challenge is not the booking itself, it is the integration with the EMR. One IT professional explained, "ZocDoc and MyChart both work really well for scheduling, but the real challenge is integrating with the EMR. Physician templates and EMR data layers make it complicated." One professional put it very clearly: smaller clinics are being left behind unless they are part of a larger hospital network. Vendors do not put resources into expanding scheduling integrating with the EMR. Because of this, many independent clinics end up with scheduling tools that do not communicate with their EMR, creating duplicate entries, missed data, and administrative headaches. For these smaller clinics, online scheduling can feel more like an expensive add-on than a true solution. Interoperability and open APIs may finally help bridge this gap. Thanks to the 21st Century Cures Act, all ONC-certified EMR systems are now required to have public-facing APIs. That means your EMR can, in theory, communicate with your scheduling software, your insurance verification tools, and even your patient portal in real time. This kind of connectivity allows for automated eligibility verification and more accurate data sharing before the patient ever steps into your clinic. Imagine patients booking their appointments online and having their insurance checked automatically, without your front desk needing to make a single call. That is where healthcare IT is headed, and it can make a big difference in efficiency and patient satisfaction. Larger hospital systems have already taken big steps toward full automation. One IT professional shared how their oncology EMR connects directly to a system called QFlow. This system manages appointment reminders, ticket numbers, kiosk check-ins, and patient routing throughout. It is impressive, but let's be realistic, most small outpatient clinics are still managing patient flow through manual, so where does that leave smaller clinics like yours? The key is not to adopt every new scheduling tool that appears on the market. The real goal is to find solutions that truly integrate with your EMR and simplify workflows instead of look for tools that automate eligibility checks, support open APIs, and actually reduce the administrative load on, because in the end, scheduling is not just about booking time slots. It is about patient flow, staff efficiency, and the overall experience your clinic delivers. Thank you for tuning in, doctors.